Breast cancer is the #1 cancer affecting women in the world. It's the #2 killer by cancer by women in the world as well. And that, PEI women are no different than that. When I started practicing over 25 years ago, we learned that 1 in 11 women would develop breast cancer over her lifetime. Well, 25 years later, we now know that 1 in 8 women will develop breast cancer in her lifetime. So breast cancer is on the rise. But we also know that women with breast cancer are living longer. We're finding breast cancer at earlier stages, and we have improved treatment. So that's resulted in women living longer with breast cancer. So we're doing some right things, and one of them is screening mammography and mammography in general. So we know over a 10-year span that just due to screening mammography, we decreased the mortality of women by 41% in that 10 years. So mammography works, it saves lives. So what is a mammogram? Well, this is a mammogram machine, and a mammogram is an X-ray specifically designed to detect breast cancer. It's just an X-ray. Well, this particular piece of machinery and the one next door, we have 2 mammogram machines. They're over 12 years old. The life expectancy for this equipment is actually 10 years old. So they're getting a lot of wear and tear. So just like an old car, there's a whole lot more maintenance on it. There's a whole lot more repairs on it. It's more expensive to repair as well. It's harder to get replacement parts, so we have a lot more downtime because it's old equipment. But just like your old car, technology has improved in that 12 years. And mammography is no different. So the newer machines allow us to see breast cancers more easily, and it's less radiation to the women's breast. So for those 2 big advantages, having new equipment is tremendously important. So one of the 2 pieces of equipment that we will be receiving will have an additional component to allow us to do tomosynthesis. So tomosynthesis is like a CAT scan, if you will. And the advantage of tomosynthesis is we just see things so much better with it. Right now, we're forced many, many times to then subject a woman to a biopsy because we're just not sure if it's a breast cancer or not. But with tomosynthesis, we can be much more confident when we say it's something we're worried about or we're definitely not worried about. So it should decrease the number of biopsies and therefore the stress in women's lives having to undergo that. But what I really wanted to say is, I've been here a long time, and the QEH Foundation and the fundraisers have just done a phenomenal job in supporting us. This isn't my first go around with equipment and purchasing the equipment, and I've seen it directly how the fundraisers have supported us, and we've saved women's lives because of that, and how the impact on women and families, it's just been a wonderful experience. And without the fundraisers, opening up their wallets and giving us money for new equipment, we couldn't do what we do, and it's directly impacting families on PEI. So I really want to thank everybody for being so, so generous.